Hi, it's Peter with Physical Therapy TV. In this video, I wanted to just give you some helpful points as far as relating to shoulder joint pain. If you are struggling with shoulder pain, either started recently or you've battled with it for quite some time, it is important to understand why is it that your shoulder hurt. So from a physical therapy perspective, when we see a new patient in the clinic for the first time, we would consider a couple of things. We would look at, is it an overuse injury? Was there trauma involved? Is it related to weakness of specific muscles in your shoulder joint, such as the rotator cuff muscles? Or could it be related to a biomechanical cause, such as habitual poor shoulder positioning? This would be an example of somebody who sits for a living, or who has to drive a lot, or somebody that doesn't place their shoulders in an optimal position habitually during the day, and you've got this forward stoop posture. This is probably the number one cause of impingement pain that can lead to rotator cuff tears, rotator cuff impingement, and a whole host of problems. So usually this is the easiest also to fix when we see our patients. Now when you have pain, it is important to pay attention to the symptoms. The area of the pain in your shoulder can actually tell you a lot. Usually if you have pain alongside the side of the shoulder, and if you poke along the side of it and you can poke on a real tender spot, that might be something like what we call a rotator cuff tendonitis. If it's a generalized pain that's there chronically, it even radiates down the shoulder, never goes away, gets worse when you lift weights, could indicate a rotator cuff impingement or even a rotator cuff tear. Typically, tendonitis, which is inflammation of a muscle tendon, you can poke in different spots in the shoulder, and you can identify, usually in the front, if it's like biceps tendonitis. On the side could be a supraspinatus tendonitis. In the back it could be an infraspinatus tendonitis. The last two are your rotator cuff muscles, and obviously your biceps is the muscle that's responsible for bending your elbow. So paying attention, bottom line, to symptoms in your shoulder can tell the doctor or a physical therapist a lot of exactly what it is that you're having to deal with. So what can you do? You're not sure what type of injury it is that you have, what caused it. The first thing is to end the irritation. So if you know specifically about some movements or things that you do during the day that hurts your shoulder, obviously you want to stop that. Then also ice and rest is a great way to stop inflammation and irritation. A doctor might prescribe a cortisone injection or anti-inflammation. Usually that does help. And then lastly, a proper shoulder stretch and strengthening program will greatly help your shoulder joint. I have compiled some free information for you over at theshoulderreport.com. It's just some helpful tips and things you can do to get shoulder pain relief. It is important, though, that if your shoulder pain is getting worse, or if you had a long time, that you do seek medical attention, and make sure that you clear anything that you learn, whether on my site or any other website, with your doctor first.